So you need to understand the patient actually as a person in order to manage it better. If you don't know, and if you do not, why it is important? What additive advantage is going to give you? 15% of the clinical interactions with the patients are perceived as difficult by the doctors, and difficult the situation is different for every physician and every person. So for instance, I'm not an Arabic speaking doctor, and there is a patient who doesn't know English, or he's an Arabic patient. It's a difficult patient for me. But obviously if the patient knows, if you are a doctor and you know the Arabic, it's not going to be difficult for you guys. All right, and it also depends on what is the competency of. It depends on the competency level of each doctor, which makes it more difficult. Improving physicians' communication can lead to increased patient satisfaction. So if you identify the problem, the condition, and then you respond to it, what is going to give you the benefit is patient is satisfied. Increased healthcare professional satisfaction, improved patient health outcomes, and decrease in complaints and lawsuits. Understanding the patient's agenda, expectations, improves the compliance and the follow-up. So you are improving your communication, and it's going to impact you on your own personal mental well-being as a physician, number one. Number second is, for the patient is going to be more compliant, more satisfied, less lawsuits. When you go into your hospital rotation and your internships and then your residency, and then you find that there are complaints from the patient, more than 80 to 90% of the patient complaint is because of lack of communication. Usually physician does not tell the patient the right diagnosis, does not deal it in a right way, inappropriate way, patient got insulted, and things like that. These are very minor issues. There are very little complaints regarding the medical competencies, but there are a lot of issues regarding the communication and interpersonal skills of the team as a whole. So if you want to analyze the situation, the factors, we have 2-3 categories in which you can make the problems more difficult. One is the environment, which is called the situational issues. If there is a language problem, if there is a literacy problem, if there are multiple people in the examination room, it also makes very difficult for you to interact with the patient. For instance, there is a breaking bad news, and some environmental issues where you do not have a privacy to the patient, you don't have very crowded space, and they are very difficult to interact. So these are all situational issues which can make it more difficult. And then you say physicians, if the physician is angry, defensive, fatigued, hurried, maybe an arrogant physician, can also make the situation is very difficult. Patient factors, if the patient is, what we discussed in the beginning is the patient factors. If the patient is angry, defensive, frightened, manipulative patients, these are all manipulated, they want some ijaza, and they came here to do some kind of things, and they wanted to, in the end, they want an ijaza. If you do not give them, no matter how good medication you give, they are not going to be satisfied with you. So you need to understand the patient's agenda. Manipulative patients, somatizing patients. Somatizing patients patient thinks that it's the firm belief that the patient has cancer. Doctor, I have cough, and I think that I have lung cancer, although he's a young patient and doesn't have any risk factors. So these are somatizing patients. There are grieving patients. Patients are very depressed, and there are frequent flyers. The patient wants to come to you to see you, not to take the medication, but to discuss. There are elderly patients. There are patients who just wanted to have chit chat with you. So once you identify the agenda of the patient, only then you can address those agendas appropriately, which can lead to good patient satisfaction. So we have see different patients. What does this patient look like? Manipulative. So these are actually a demanding or unreasonable patients, or patients with high IQ, as you mentioned. The patient knows very much and they are actually driving you. Doctor, I know this, and doctor, there is a very good treatment on this website, and you should give me this one. This is a very expensive treatment. If in those situations where the patient needs some good medical insurance claims, they can get it. So these are demanding patients, and the challenge is they don't have experience. They are emotional patients. Lack of background of the patient's demands, conflicting messages from the other healthcare professionals. So they can say, okay doctor, you are saying this, but the other doctor was saying this. So then you get nervous as a physician, that did I go wrong? And for instance, your knowledge is not updated, but he gave you some updated things which are actually not relevant, but he's giving you recent things which makes your life very tough. There are recent, if you think in a corona situation, there are a lot of new things which are coming up again and again, and then you should know that okay, this is a demanding patient. So you don't give information, you give references to that patient. How are you going to tackle this? You give references. Okay, you can go and look up this thing in the Google and these guidelines and these guidelines, so that the patient is going to be satisfied in that way. Yes, if the physician is a patient, then it's going to be very difficult. Yes, indeed. And what not to do is don't respond to the unreasonable demands. Don't argue, don't lie, don't offer temporary measures, don't put yourself into dangers. All right? What you can do is you should document what you are doing in your consultation. You can seek senior support and avoid maybes, because these patients, they want clear cut and hard facts. And avoid personalizing conversations. So you as a physician, he as a patient. If they come across with an argument, do not take this as a personal argument. Take it as a professional argument and deal it professionally. So that's going to solve the patient and those patients who are very demanding. What kind of patient is it? Low IQ. Very low IQ. They are very simple, and they understand simple words. If you are going to give them high IQ questions like you can do this and you can also do this and we also have this and we have he said, okay doctor, just let me know what should I do and what should I not do it. So just simple as that. So don't give them extra information. So you need to give safe environment. You need to have a chaperone. Low stimulus environment, excellent communication skills. What not to do, don't ignore the physical health and don't rush the consultation. So do not rush, do not take them for granted. Okay, they're not going to understand in any way. So why should I bother to tell the patient about all these things? Give the information which is understandable to the patient, small chunks, and straightforward. That's going to make your life and the patient life easy. Give very to the point things so that he can grab one or two things and keep it to himself. So patient with low IQ, you need to deal it very differently. Yes, patients with multiple problems. Time is a very good limitation. Lack of experience may also be a very challenging thing, because there are a lot of issues in it, and sometimes you also come across in general medicine in your surgeries that there are lots of issues in this patient. You say that you go into your systemic review, and from every system they have a problem. Chest, yes. CVS, yes. Legs, yes. Lumbar pain, yes. Hand pain, yes. Neck pain, yes. Head pain, yes. Everything is yes. So then you need to know that, okay, my God, if I need to analyze all these 10 problems, how am I going to do it in this 2 hours, in this 4 hours maybe? So what you need to do is prioritize these problems. you need to make a list of what are the things that you will going to address in this consultation, and later you need to put later things in later one. Do not argue, do not get frustrated. Reassure the patient, your clinical judgment, prioritization, document. Very problematic thing, unpredictability and the staff safety. So you need to be very calm, involve the psychiatrist if it is relevant, and don't confront the patient. He's a sick patient. He's psychiatric problems. So if the patient is very rude to you, so don't take it personally. It's something which is because of the situation. So you need to address this. So pre-deduced patients, preconceived opinion that is not based on reason. This is we call somatization. The patient thinks that he has something, or he thinks that he has a strong perception of her or himself that he is not going to get better. So this you need to address these problems. The problem is that what not to do is react to the video and take it personally. If you're taking it personally, it's not going to give you most benefit. You need to educate them. You need to give time to think, offer alternative care, and remain fair and unbiased. So the patient wants an unbiased opinion from you as a physician. It's kind of a taboo. If the patient thinks that I have a taboo, like if I have an acne and he says that, or he or she says that, okay, I cannot move into the community and I'm very depressed and very low, and things like that. If I'm a young patient, I have a hypertension or I have a diabetes, so it's not going to be very well accepted in my community. So these kind of things, they have these problems. So try to give them good support, educate them, understand them, and then you can give your management plan unbiased. So these are manipulative patients. They want to get things what they want from you. They want a test actually, and then you're giving something, a pill. That's not going to help them out. It's not going to satisfy those patients. Maybe confronting, you do not confront those patients, do not confront them. Involve others, you can involve other people, maybe your supervisor that he's asking unreasonable things from you which is not required at this moment of time. He wants some fitness certificate or he wants leave application and it's not required in this medical condition. So you are not going to do this. But you need to document and you need to involve your senior. These are the two things that can help you out. Because these manipulative patients, they are very clever, they know the system, and they can file a suit for you in front of you. If you do not document, you do not involve your supervisor. Yes.
So first a patient like addict for morphine, and he came like with the symptoms and looks like relapsed. So what should we do?
Looks like the patient wants morphine.
Yeah.
And this morphine is not because of the medical condition, he is addicted to that. Then we have aggressive, angry patient. They are not very uncommon. They are very common. People get angry very easily and not very rationally. So you need to be very careful that the patient is very angry. So what to do? Follow the protocol. Okay, if the patient is very angry, okay, please deal this patient, and I am sitting here for the last 5 hours. This is not the way, and the patient is stable, and there are 4 patients in front of you, and you just because the attendant is very angry or the patient is very angry, you cannot skip your other patients. You need to follow the protocol. But how are you going to do it? You can ask your paramedical staff. You can involve the security unit to protect this. Maybe you can ask the patient to schedule another appointment if he cannot wait. He has to go somewhere. That's his problem. But you need to follow your protocol, and you involve all the other members with you so that you can deal the situation. Don't miss the potential injuries and don't judge them. So do not ignore them and do not overly judge them. Try to make it a professional environment and deal it in a professional way. And then we have children. Children are very special, and every children is very unique in their personality. You have gone through your pediatric rotation, right? All what the children is doing is crying or laughing sometimes. This is what they can do. But with this crying and laughing, you need to assess different medical conditions in your pediatric age group. So that's an art. How are you going to do it? It's not just a history taking, simple history taking. You need to actually sometimes play with the children. You need to do peekaboos, and you need to spend some time so that you can get more. You can examine the children more comfortably. The only problem is that you cannot listen to the heart or the chest because the children is crying in front of you. So you need to be very careful. So what you should do? Non-verbal communications, charts, pictures, toys. Use the mother to interact with the children, and don't speak really slow. And then we have different languages. The patient doesn't know your language, or you doesn't know the patient language. So what you can do? Use a qualified interpreter. Ask the patient to summarize. Non-verbal communications. Non-verbal communication becomes very much important. Try to communicate with the patient one-on-one as much as you can with the non-verbal communications. Okay, so you have headache, you have pain here, and things like that. You usually do it with the patients who don't know the Arabic, who doesn't know the English and things like that. So try to use those non-verbal languages very effectively and use the interpreter if you have the facility. Then we have patient with difficulties expression, maybe dysphagia or deafness. So you would like to give some verbal or some pictorial education to the patient and interact with them. So until unless you don't know what is the problem to the patient, you cannot address this issue. So before going and jumping into the presenting complaint and history of presenting complaint and systemic review and all that, you first need to know, okay, the patient is understanding or not, the patient is able to listening or not, is listening to me or not. So you need to keep this thing in your mind. You can take the history from the relatives in this situation, no problem. So now the patient with multiple relatives. So different agendas, different people have different agendas, multiple people present, family types, emotional state, unrealistic expectations. These are all challenges in the patients who are occupied or surrounded by a lot of unrelated relatives, or you sometimes see those patients, attendants who you were managing for the last 1 week and as an inpatient department, and all of a sudden the son comes after 1 week time and he's become very angry and you are not doing anything and things like that and blah blah blah. So then you need to realize that, okay, if you are very caring about this patient, you should have come at the beginning. My contact person is this person. We were in contact with this person, for instance, that the family nominated or the patient nominated this person as a representative from all the family members. So if you want to be the representative, you should have come at earlier. He is the representative person, and I am going to talk to this person only, not just every single brother or sister or cousin is going and coming and yelling at you. So try to fix your contact person and try to deal in this way. So you need to be prepared for yourself, ask the patient what they want, try to identify his patient point of contact, suggest a formal separate appointments. So documentation and your treatment plan and your management plan is going to decide how are you going to manage those patients. It depends on the situation. So the last recommendations are verbalize the difficulties. Okay, if you think that there is a problem with the patient and they don't communicate, so you can verbalize to the patient that I can see that you cannot understand my language. I can see that you cannot hear me, you cannot listen me properly. So these
these are the things you can verbalize. Once you verbalize the difficulty, the situation is going to be normalized. I can see that you're very angry. I can see that you're very frustrated. So the patient will see that, okay, now the physician is actually understanding my problem. Support the patient wherever it is required and however is required, but set the boundaries where appropriate. You can always find some common grounds. You can find some common grounds and build on those common grounds your consultation. You need to stay calm, professional, and try to see the consultation from the patient's perspective. You can also understand the patient's feeling, why he is angry, why is he manipulative, why is he depressed, things like that. You should always work together with the patient, and that okay, now we are with this situation and we can handle this with this. Then have a deep breathe. You can have a structure, and then you can have a demonstration. Okay, this was your problem, and we have dealt in this way, this, so that the patient understand that okay, now the physician is doing whatever he can do, but there are still limitations to the patient, to the system, to the conditions. So there are some communication techniques. How are you going to demonstrate that improve the listening and understanding? So first, what phrases that you can use? What I hear from you is that, did I get that right? This is how these are the small phrases that you use it to realize that I am listening very actively. And then improve partnership with the patient. Okay, how do you feel about the care you are receiving from me? So you take the patient feedback. Improve the skills at expressing the negative emotions. It is difficult for me to listen when you use this kind of language. So you can verbalize the issue. Increase empathy, ensure the understanding of the patient's emotional responses and conditions, and negotiate the process of care. So understand, verbalize, structure your consultation, keep the negative emotions away from you and from the patient, and then involve the patient into the care plan. It is going to give you good benefits, not in terms of an outcome, but also in terms of the relationship with the patient doctor. That's very important. So these are some important tips and consultations of the difficult patients and how are you going to deal it in a different way. When you are going into your primary health